Hello everyone, I'm Dr. Vaibhav Garg, MD Medicine first semester resident at PGI Chandigarh, and in this video we are going to talk about how is the medicine residency at PGI Chandigarh, how the various rotations among different super specialities and emergency duties scheduled across the 6 semesters or the 3 years of your residency. So here we begin. So coming to the internal medicine residency at PGI Chandigarh, because the INICT exam is held every 6 monthly and it is held twice a year, so there are 6 semesters who are working together in a hospital. And first, I'm going to talk about the first and second semester. How does it look like? How are the emergency and specialty postings scheduled across the first year? So in emergency postings, in each semester there will be minimum one emergency posting, and sometimes they can be twice in a semester also, depending on your roster, which is basically a random allocation of the postings. So each emergency posting is of 2 months duration, and across this 2 months you will be posted in various halls like Hall A, Hall B, Hall C, Hall L, and emergency ward. The various halls are divided based on the severity, and the triage is done between the red, which is the oxygen requiring, or the intubated patients, coming down to the yellow, which is more stable relatively. So in emergency there will be 6 months. In emergency duties there will be 6 days of duty followed by one and off after every 6 days of duty. So there's a once a week off in emergency duties. And a typical day in emergency starts at 8 a.m. and mostly after finishing all the work and procedures, you can get to leave by 9 to 10 p.m. Whereas if you're posted in night duties, then your duty will start at 8 p.m. and after finishing all the work, you can mostly get free by 9 a.m. or so. Sometimes the timing may extend if the rush is more than usual, but that is not much of an issue. In first semester, your basic task is to do and ensure procedures and sampling. Procedures like central line insertion, ICTD, lumbar puncture, taps like a sighted tap, pleural tap, and ensuring that all the workup is sent timely and the reports are available by the evening. So phlebotomists are present in emergency from 10 to 4 p.m. So sampling outside of this timing, and to ensure that radiological investigations like ultrasound, MRI, and if any nuclear medicine scan has to be done, that is done in a timely manner. In second semester, your case taking would begin in emergency. You will begin working up the cases and deciding what the management would look like, and you'll present them in rounds to the consultants, and basically ensuring that workup is being sent and procedures are being done. So along with seeing the cases. Apart from emergency posting, there will be 3 to 4 specialty postings amongst these 9 or 10 places, but that would mostly be based on random allocation. So the postings where you can be posted are nephrology, endocrinology, gastro, IM1, which is basically infectious disease, CHMO, which is hematology and medical oncology, private ward, cardiology, neurology, hepatology, IM2, which is basically rheumatology, immunology. So you will be posted among any 3 or 4 of them in the first year. And according to your postings, there could be a ward or ICU duty. Like I was posted in hepatology, so there was a liver ICU in which I was posted for around 20 days. So that can differentiate and vary according to the place you are posted in. The tasks in the wards and in the specialties basically sampling. Some of the places have phlebotomists, where others don't have. So sampling has to be ensured, and by the evening the reports are going to come online, so you have to basically print them and see any abnormality, and ensure that all the reports are being collected, and to take early date or discuss the reports, and ensure timely collection of the reports from radio department or nuclear medicine department for the investigations, and making the calls. Like there's a super specialty on call number for each specialty, so you can call them and discuss the case and ask them to optimize the management for the case, or come and assess the patient personally. So the on-call SR will come when they find time. Also, sometimes checking on the status of reports like biopsy, cytology report also has to be done. So basically, this is what your first year would look like. Mostly the duty timings will be around 12 to 15 hours or so, and in some of the places there would be night duties once a week or so. So that time the timings might extend a bit. Coming to the third semester, you'll be posted in 2 months gastroenterology, 1 month of rheumatology, 1 month of infectious disease, 1 month of endocrinology, and 1 month of nephrology. So this is what your third semester typically looks like. In the specialty postings, there's OPD duties and the ward duties. Whichever day that specialty has OPD, then you have to go to the OPD and discuss the cases with the SR consultants and write their management. And in ward, you have to take up the cases for admission. The cases might come from emergency, or they might be admitted from OPD for some procedure, or as per the condition of the patient. So taking history, examining them, deciding what workup has to be sent, and presenting the cases in the rounds, grand rounds, in the clinical pathological conferences or student clinical meet, JCs. That all has to be done by the third semester resident. Coming to the emergency duties in third semester, so in around 4 months of emergency, except the gastro posting of 2 months, there are going to be 4 to 5 night duties, night holiday duties per month. So in between the specialty posting, there's a provision of the emergency night duties. So but the next day after the night duties, mostly an off, because you get free by 12 or 1. So this is off the next day. In gastro, since the timings are relatively more, so there won't be any emergency night duties, but you will be posted in emergency on Sundays. So that is the difference there. Coming to the more senior semesters like 4th, 5th, or 6th semester, in the 4th semester, there is going to be 1 month of compulsory emergency posting, and 1 month of hepatology posting, where again you can post it in ward or in ICU depending on your roster. So in emergency duty, there can be case taking duty of from Monday to Saturday, of around 8 to 10 hours duty timings, and followed by an off on Sunday. Whereas in triage, again you can post it in morning, evening, or night from Monday to Saturday, and mostly the 4th semester residents have an off on Sunday. Rest of the time in the 4th, 5th, and 6th semester of around 1.25 years, there are going to be 2 months of postings in pulmonology, 2 months in cardiology, 2 months in neuro, 1 month in derma, 1 month in psych, 2 months of internal medicine OPD, 1 month in CD ward or the communicable disease ward, 1 month of clinical hematology and medical oncology postings, and 2 months in ward nights or triage nights, which like this roster which is made in between, of which these ward night duties will be there. So this is how the residency is scheduled across the various 6 semesters. Sometimes the timings can get hectic, sometimes they can be way less, like you can get free in a couple of hours also. So that is variable, but what I've observed and what I've heard is that mostly we get to sleep every day, minimum 6 hours. Sometimes because of some presentation or upcoming stats meet or something, the timings might reduce, or if the thesis work is there and you have to complete them timely, then that because the timings might reduce. But other than that, there's no overburdening as such with the duty timings. But definitely, if we are the junior residents, that the term itself says that the residents of the hospital, so that is true across the nation, that timings for residents are more than it should be. But what I've feel is when I've talked to other residents at other places, the timings are even more than that at PGI. So in that way, it's not extremely hectic as I had heard before joining. So I would say that it is much more manageable than other places. So if you're getting an opportunity to join, then don't leave it only by the hearsay that it is very hectic, right? So if any of you is thinking about joining PGI Chandigarh for internal medicine residency, you may directly contact me and ask more about it.